And welcome everyone to Nutrition Science Bites. My guest this week is Dr Hiba Jebeile. And Hiba is an early career NHMRC research fellow and a research dietitian also at the University of Sydney and works a lot with the Children's Hospital at Westmead. And her research is focused on the impact of behavioural weight management interventions on eating disorders risk, and especially in adolescents and young adults. And that's actually why I've invited Dr. Jebeile to come along and talk to us today. So welcome, Hiba.
Hi, Claire. Thanks for having me.
It's such a specific area of expertise that you've built over time. So can we start by sharing with us, how did you get interested in the overlap, or whether there was an overlap, in fact, between weight management and eating disorders? Because I think most people would probably, in their minds, just think those things are poles apart.
Yeah, that's right. And it is a very specific area to work in. And I guess I first became interested in this many years ago now, probably almost 10 years, when I was working as a dietitian in private practice and I was working on community programs with children. And I had my own young children. And I think this was at the time when social media was really taking off. And I was following lots of other dietitians who were talking about this risk of dieting and eating disorders. And so I think, being a dietitian and working in private practice, I was seeing lots of patients with obesity and type 2 diabetes and using different diets. And I guess I became interested from that angle to really understand, well, what is the risk of dieting in the context of obesity treatment? And if we are trying to help people with weight loss, what is that eating disorder risk? And I think that led me to do my PhD at the Children's Hospital at Westmead, looking at diet interventions for adolescents, but really digging a bit deeper into eating disorder risk as part of those interventions.
Yeah, and I think, Hiba, like, I'm sure every parent's deep fear is that if they're trying to support children and adolescents in becoming healthy at the weight they're at, that's a really big fear that, oh no, what if I, trigger an eating disorder? So this is a very, very important area. And so is there an increased risk basically for people seeking treatment for improving their weight-related health? Are you going to give them anorexia nervosa?
Yeah, look, that's a good question, Claire. And we've done quite a lot of research to try to understand this issue. And so we started by doing systematic reviews, which, as you know, is trying to look at the whole evidence base and see what that risk is. And we found that when people, undergo a structured intervention with health professional support, that it doesn't seem to increase their risk of eating disorders. But there are limitations with the evidence base, as you know, and so our current research is trying to dig a little bit deeper and have a look at whether there may be a subgroup of people or a small number of people who are at risk of eating disorders.
Well, I think first up that is quite reassuring. And I heard two messages there. One, that if you're seeking or trying to help your children and I presume yourself as well, improve weight-related health that actually does require a reduction in body weight, you're not going to trigger an eating disorder, so it's safe to proceed. But that second caveat's really important. You said this was from research where the intervention was provided, you said structured, but that extends to like qualified health professionals providing that support.
Yeah, absolutely. They were all supervised interventions, often included multidisciplinary teams. So they may have included, a doctor, a medical practitioner, a dietitian, and some had psychological support as well. So that's one of the challenges, Claire, that we know that people actually find it quite difficult to access that type of support.
Yes, and I know that we've talked about this before, that particularly when we're talking about children and adolescents, those very structured programs tend to only be in the children's hospital. So, and I know sometimes, we think you've got everything you need down there in Sydney, and there is a program here in Newcastle as well. But for people who live, what happens if you live out in a regional town? What can those people do to access this more structured support? So what would you tell parents and adults themselves living in regions where, yeah, there's lesser support for improving weight-related health?
Yeah, that's one of the real challenges. I mean, I think people should always start by having a chat to their GP and, familiarising themselves with services that may be available locally. There likely may be a dietitian. I think we're really lucky post-COVID in many ways that telehealth has become available and you can access many services now online, as well as there being some online programs. So I think that's the key message, is to try to seek support from your GP or a health professional and not try to go it alone, particularly for children, for parents not to try to impose or, restrict their children's diet until they've seen a health professional and have that guidance.
Yeah, that's very practical advice. And of course, in this day of telehealth, it means that people won't be as isolated. But in fact, like if you do live in a regional area, that's going to be way more convenient to have a telehealth consultation than, drive down to a city that may be hours away. Not to mention that I know all the big hospitals have very long waiting lists. So I think all in all, that's a good reminder. Start with your GP and then consider that telehealth options may be the best way to get the support early. Are there any places that people could, visit online, for example, like get some information to make a start on thinking about how they're going to support their children or how they're going to approach this for themselves while they're waiting to get into those medical services?
So there are some websites through New South Wales Health that have some basic tips on healthy lifestyle. They're called sort of 8 healthy tips for a healthy lifestyle, such as trying to increase our fruit and vegetables, increase water, trying to be active as a family. It's clear all of those, nutrition, healthy lifestyle messages are where parents can start while they're trying to seek support.
Okay, and I'll put a link to that in the show notes. I'll follow up with you, Hiba, so that we can make sure parents can access that website. But I wanted to ask you next, you said in most cases that eating disorders risk is not increased, but you kind of intimated that there may be circumstances where it is. So from the literature then, from the research you've done, are there any like red flags that or questions that or things that people can look at and go, "Oh yeah, we've got that or I've got that or my child's got that." And then that's a little bit of a flag that beyond the advice you've just given about seeing health professionals, that they then may need to see someone who's more specialized in eating disorders?
Yeah, that's right. And I think, Claire, one of the things to highlight for people is that eating disorders, when we think of them, I think the stereotype for eating disorders is that they typically affect people with low weights. But what we know from the literature is that eating disorders are actually more common in people with high weight, both in children and in adults. And so when we're thinking of, interventions for obesity or weight reduction interventions, I think it's important to consider some of these eating disorder behaviours and if they're present. And that may be one of the factors that we're missing, is that if that assessment wasn't happening, not knowing the effects of these interventions in those people. So if we think of what some of these behaviours may be, it might be having unhelpful thoughts about food and about eating. Some people may feel like they lose control when they're eating, or may overeat excessively. So more than, not just at Christmas, but it might be a regular occurrence that they're having times when they're overeating, eating in secret, and losing control of that eating as well.
Yeah, so the person is really feeling like this is problematic. It's not, as you said, it's not because you're at a birthday party, but it's something I imagine triggered maybe because of stress or like, some other pressures in their life.
That's right. It could be triggered by some distress, but it also causes distress for the person and can impact on their, their daily living and the way that they're living their life.
And it's probably fair to say that for most treatments for weight-related health, that a screen for eating disorders and disordered eating is actually not routine, even though the research you're doing is suggesting that it should be routine. So how can that come into practice more commonly? Two-part question. And can people self-assess for this? Or make an assessment of those broad characteristics in their own children?
Yeah, definitely. So there are recommendations now that for people who are seeking obesity treatments or are seeking support for weight loss, that we should be screening for eating disorders and disordered eating. And there are some screening tools available that GPs can use, but also people can do a self-assessment. So on the Inside Out Institute for Eating Disorders website, they do have a screener that people can use as a self-assessment if they feel like they may have some of these behaviours, or they may feel some distress around the way that they're eating and feeling about their body. So they can use that screener. And they can also reach out for support through the Butterfly Foundation. They have a helpline for people if they want to just talk about some of these thoughts and behaviours and they're really not sure where to go. They can reach out to that helpline as well.
Well, that's two practical resources we also will put the links to in the show notes. And so the screener, and then also the From Inside Out, and then the Butterfly Foundation. Yes, the Butterfly Foundation website's really quite amazing. And what I really like about it is the direct resources for young people themselves, for their parents, and the fact that they've also got resources for teachers, because I can imagine teachers who spend so much time, with everyone's kids, that sometimes they're observing behaviors and they want to know a little bit more information, or they want to promote a really positive environment in the classroom. So they're really great resources. And what are the sorts of questions you mentioned about the, eating and overeating causing the person distress? Are there any other sort of broad characteristics that, might sort of raise for people a little bit of, oh, okay, maybe we need to look at this more closely within our family network?
Yeah, that's right. I think the other, maybe big red flag might be what we call rigidity, or having some very rigid thoughts around food and around eating, or rigid eating behaviors. So this might be if somebody has very strict rules around what's a good food and what's a bad food, or they may choose to eliminate a whole food group, really for reasons that are not medically related, or be very strict in their calorie counting or in their exercise regime, to the point where they may not go to social events because they don't want to miss their exercise classes. So having some very sort of rigid and strict thinking and behaviours around food and exercise as well can be another red flag to look out for.
Oh, well, that's really helpful, because there's definitely a difference, isn't there, between like monitoring some behaviors because now you're on a program versus the distress that's associated with it because you've missed, your scheduled walk, or because you haven't been able to count the kilojoules on your plate because you're at a social event or something like that. So I can see the very distinct difference between those types of behaviors as well.
Mm. Yeah, that's right. And I think that's where this area of overlap becomes quite complex for patients and complex for clinicians who are providing obesity treatment, because we know that some of those behaviours are actually quite helpful when we provide nutrition education. We may ask people to keep a food diary, or to track what they're eating on a day-to-day basis or over a week to help determine their nutritional quality, their meal patterns, and try to help them with behaviour change. But then for some people, that could become too rigid or too obsessive. And so it's trying to find that balance and that fine line between some of these strategies that we know can be quite helpful for people, but identifying when they become harmful.
But I think you raise another good point, because you've told us that the literature says that the risk is lower for people of having these dual conditions of eating disorders and obesity if they're participating in structured programs where you've got that array of health professionals. But the other thing to me then, someone participating in that is actually getting that monitoring and support. So perhaps then that's actually why these things, if they emerge as treatment gets underway, that structured program and the staff are going to be there to support the person or ensure they're getting the care they need.
Well, that's right. And that's why we suggest that it's helpful to have some initial screening for eating disorders before you start an intervention, as part of this holistic health assessment, but then also to have some monitoring. If we're using any dietary monitoring strategies, or people are attempting weight loss, that we also touch base regularly to check for any of these red flags that might emerge.
Okay, so now the next thing I wanted to ask you was then, Because again, I think a parent might be trying to support their adolescent, or a person, an adult, trying to help themselves. Should they just give up because they go, oh no, what if I trigger this? So I want to know, what happens if you ignore, if you you think, oh, there is some red flags around disordered eating, I'm just going to totally ignore it and just either plunge on or completely, I'm not going to do anything. Like, is there a risk that all of these issues will make people feel more despairing?
Well, that's right. And I think if people have some disordered eating, and that's ignored, that can very well develop into a full clinical eating disorder. And at the same time, if people have high weight and some of those weight-related complications, we don't want to ignore that either. That they may need some assessment and treatment for that. So I think it's really key that children as well as adults are having holistic health assessments. So we're considering their physical health as well as their mental health, and then always coming back to that person-centered care to see what is the best treatment pathway for this person. For some, it will be prioritizing the eating disorder. For some, there may be a way to provide treatment for both. And for some, it may not be necessary to address weight at all. And so it's at that person-centered level, working out what is best for that person at that point in time.
Thanks heaps, Hiba. So just something I'd like to ask you about, because I know that you didn't just stand by and say, oh, this is a problem area. You've actually brought researchers and clinicians, so all the health professionals you've been talking about, together to try and keep solving this problem. Can you tell us about that network that you've set up?
Yeah, so that network is called the EDIT Collaboration. And so what we're doing as part of the EDIT Collaboration is really trying to look deeper to see if there is this group, subgroup, a small group of people who may be vulnerable to eating disorder symptoms during an obesity treatment. Because although when we look at the literature as a whole, it looks like risk doesn't increase, but there have been studies that have reported small numbers of people that are potentially vulnerable of developing some disordered eating symptoms, and we've seen that in our own research as well. And so even though it is a small number of people, I think eating disorders are quite a serious mental health condition. And so what the EDIT collaboration is trying to do is to see if we can identify who those people are, and then see if we can predict who they might be to help inform maybe new approaches to screening, and to see if then they may need a different treatment pathway. So we're doing that by, we formed this global collaboration, and we are combining data from randomized control trials around the world to form a large data set to see if we then can have a large data set to do some quite complex analyses in and see if we can identify this subgroup of people.
Yeah, that's amazing that you're bringing the world together rather than just sitting back and saying, oh, there's a problem. You're actually doing something about it. So that network, we have a lot of health professionals who listen to this podcast. So are clinicians interested in this area able to join that EDIT collaboration?
Yeah, so anyone who has conducted a randomized control trial of a weight management intervention and has measured eating disorder outcomes can join the EDIT collaboration. But also, if people are just interested in this area, they're interested in understanding the research on obesity treatments and eating disorder risk, or the overlap between these two conditions, they can join our mailing list and our community of practice. And so what we do as part of that is we send regular newsletters with sort of new publications in the area. And we also host webinars a couple of times a year on really specific topics related to obesity and eating disorders, as a way for people to sort of come together and discuss some of these really challenging issues.
And can we finish up with you telling us a bit about, because at the start we said people have probably heard of anorexia nervosa as an eating disorder, but is there a relationship with the more subtle disordered eating without it actually being one of these diagnoses like anorexia nervosa? Are there other behaviours associated, in this area?
Yes, so I think anorexia nervosa, I think, is seen as the stereotypical eating disorder. As I said, that people with low weight may develop anorexia nervosa as an eating disorder. Actually, the most common eating disorder is binge eating disorder. And then there's also bulimia nervosa as well. So it's important to say that actually across all of the eating disorders, they are more common in people with high weight. So even anorexia nervosa, which is stereotypically associated with people with low weight, it's actually more common in people with high weight, and they can develop those complications of anorexia nervosa while still being at a high weight. And that's a problem because it often then means that people may have their eating disorder for many years before being diagnosed, and that can then delay treatment because it's not recognised.
And you mentioned those other two, binge eating disorder and bulimia nervosa. Can you just tell listeners like what they are? Because I think sometimes maybe those two things are just assumed to be the same.
Yep. So both binge eating disorder and bulimia nervosa do involve a period of binge eating, but binge eating disorder is characterized by having sort of recurrent and regular episodes of binge eating over a short period of time, and they're often associated with distress and feeling sort of out of control during those eating episodes. The difference with bulimia nervosa is that people then may try to compensate for that binge eating. So they may try to make themselves vomit, or they may do some really excessive exercise to try to sort of burn off the calories from the eating episode. So that's the key difference between those two.
Yeah, so it's really important for people to get the help that they need or that their children need. And we've mentioned that the Butterfly Foundation is a great online resource. The Inside Out website has some screening tools. And then we also mentioned about the general healthy lifestyle areas. So is there anything else that you'd like to add before we wrap up today, Hiba?
I think just to reinforce that people can have eating disorders at high weight, and so if you do feel like you have some of these behaviours, to really reach out for support. Often people with obesity and an eating disorder have this double stigma. So that's something we didn't touch on today, Claire, but you've talked about weight stigma before, but people also have stigma associated with a mental health condition. And so it can be more difficult to reach out for support. So to find a GP that you can talk to, or reach out to one of those helplines.
And it's probably also worth highlighting that there are dietitians and psychologists who specialise in these areas. And I know, for example, that in Dietitians Australia, you can actually find an expert and you can put in the specialty that you're looking. And for people again living rurally, if they then only want telehealth, you can actually even look to that level. But good call. First place to start is with your GP, and they can help you navigate like where to next. But wouldn't you say, Hiba, I think the main thing is there actually is help out there, but it really is challenging for people to find and navigate that path. So I really hope people listening, if this is raising a flag for them, they actually do go and talk to their GP, and they do look at the Butterfly Foundation website and decide that they're going to reach out and find that support that they need to improve their overall health and well-being.
Yeah, that's right. And there are more and more treatment options becoming available for eating disorders as well. So if people have tried to seek support in the past and haven't been able to, there are now some online options available, and there are some new eating disorder management plans that people can access through Medicare to help fund some additional sessions with dietitians and a psychologist. So reach out to your GP for more
Yeah, that's
information on
really
that.
important to know, because those ones, they're set up through your GP. So people
That's right.
so big plug for our GP colleagues today. Thanks very much for taking the time out of your day to talk to us, Dr. Hiba Jebeile.
Thanks, Claire.